All right. Good morning, good evening, good afternoon, coders. How are you all doing? First of all, let me know in the chat. How do I sound? Am I audible? Is my mic good? Let me know in the chat. Okay, hello, hello. I can see all your comments. All good. Thank you for letting me know that. Okay, so first of all, Happy New Year to all of you and welcome back to the CPT Guideline Mastery Sessions here with AMCI. Yes, you heard that right. We have officially updated the name of our former 3030 sessions to new and improved CPT Guideline Mastery Session. And it's wonderful to see you all here after a short break. I hope you are refreshed, recharged, and ready to dive right back into learning. So in this series, as we have been doing, we'll continue exploring the CPT guidelines together. Each week we will focus on one specific topic, break down the key guidelines, and work through the practice exercise to strengthen your understanding and accuracy. So get ready to learn, engage, and master the CPT coding one step at a time. Hello, everyone. I can see you all. Okay, so chat is active. Thank you for coming here. So let's begin by reading out the copyright. CPT Copyright 2026 American Medical Association, all right reserved. CPC is a registered trademark of AAPC. The AAPC content found within this presentation is a copyright of AAPC. The keyword concept FTR, CHUN, AMCI, FAB 7, AMCI, ICD 10, Flip Tab, and MCG are trademark of AMCI. The credentials CPCC, RCCOC, CPMA, CPB, CPPM, CPCO are owned by AAPC. AMCI do not own right to these credentials, and the credentials CCA, CCS, CCS-P, RHIA, RHIT are owned by AHIMA. AMCI do not own right to these credentials. Okay, so today's topic is going to be anesthesia coding, and we are going to break down the key anesthesia guideline, understand how the base unit works, discuss the anesthesia time reporting, anesthesia modifiers, and review some real world practice scenarios to reinforce accurate code selection. So let's dive in and begin our session on anesthesia coding. Before we begin, let's talk about where to find these codes in your CPT manual. So you will find the anesthesia codes in the anesthesia section, which is located at the very beginning of your CPT manual, right after the E&M section and before the surgery section. So these code ranges from 00100 to 01999, and they are grouped based on anatomical site or sometimes the type of the procedure being performed. And this section also include your qualifying circumstance code, the physical status modifier. So we will be reviewing them, we'll be discussing about them in the upcoming slides. All right, coders. So let's kick things off with a quick understanding of what anesthesia really is. So the anesthesia is a medical practice that allows the patients to undergo surgeries and procedures without pain, without discomfort, and without awareness of what's done or what's happening. So think of it as a protective shield that keeps a patient safe, stable, and comfortable while the surgeon does the work. But here is the important part for us as medical coders. When we talk about the anesthesia service or the anesthesia coding, they also include the preoperative evaluation. So, what is a preoperative evaluation? Those are those visit where the physician will be reviewing the history, checking the risk, planning the anesthesia approach. That is a preoperative evaluation. And also the intraoperative management, constantly monitoring the heart rate, oxygen level, basically keeping the patient alive and stable. Also, it includes a post-operative monitoring, ensuring that patient wakes up safely and recover from the effects of anesthesia. So, anesthesia coding is not just about the procedure or the drugs, it's about capturing the full cycle of care that takes place before, during, and after the procedure. Okay, so now let's go through the different types of anesthesia because understanding these helps to choose the correct CPT code. First, let's begin with the general anesthesia. So most of you have heard about the general anesthesia. This is the deepest level of the anesthesia where the patient completely is unconscious, they do not feel the pain, and are unaware of the procedure. They require airway support, ventilation, and constant monitoring. So generally, the general anesthesia is typically used for major surgeries. Think of abdominal, like cardiac or orthopedic surgeries. Anything that require full sedation and the muscle relaxation. Next is the regional anesthesia. So this numbs a large area of your body and the patient may be awake or lightly sedated depending upon the provider's plan. So most common type include the spinal anesthesia, epidural anesthesia. So you must have heard that epidural anesthesia used during the labor or sometimes post-operative pain control as well. And then we have peripheral nerve blocks used to target specific nerves like shoulder, knee, or arm blocks. And these techniques actually allows the surgery on a specific region without putting entire body to sleep. Then comes the local anesthesia. So this numbs only a small and a specific area like numbing the skin before a minor biopsy. Okay, and the patient will be staying awake. It is usually administered by the surgeon and it does not involve any anesthesia providers. So in CPT coding, the local anesthesia is typically included in the procedure and you would not separately report those local anesthesias. And fourth is the conscious or moderate sedation. And here the patient is relaxed but still able to respond and they are awake enough to follow the commands like they will be able to breathe independently. However, it is important for the coders to remember that moderate sedations are not coded or they are not seen under the anesthesia section of your CPT manual. They are usually seen under the medicine chapter. And we already have done a session on the moderate conscious sedation. So you can go back and review those videos as well. And next comes the monitored anesthesia care. So this is a combination of sedation, pain control, local anesthesia. So MAC is performed by a qualified anesthesia provider who monitors the patient continuously. The level of the sedation can range from minimal to the deep, depending upon the patient needs. So this is often used for the procedures like colonoscopy, endoscopy, eye surgeries, and certain outpatient procedures. Okay, now let's move on. Now that we have covered the different types of anesthesia, let's jump into the anesthesia guidelines. And as I said, anesthesia services are reported using the CPT codes that ranges from 00100 to 1 And you must always remember, coders, these codes are not always used alone. Sometimes you must use the correct anesthesia modifiers along with it, such as AA, QK, QX, or sometimes a physical status modifier which ranges from P1 through P6. And these modifiers actually tell the payer who provided the anesthesia as well as the condition of the patient. Okay. And the anesthesia services must be personally performed by the anesthesiologist or provided under supervision of a physician. In next section, we will look what all are bundled or what are all included in the anesthesia codes. So in the beginning, I told anesthesia services include your preoperative care, the all those pre-anesthesia evaluation, intraoperative anesthesia care that include the standard monitoring such as ECG, blood pressure, temperature, pulse oximetry, capnography, and mass spectrometry. Also, the anesthesia service include the post-operative care, the routine post-anesthesia visits. So these items are not billed separately. Okay. Now let's look what all are not included. Sometimes the items may be billed separately when documented, such as the intra-arterial monitoring, central venous catheter monitoring, and Swan CANS catheterization. So these are not routine and may be reported separately if documented. In next section, we are going to look at the moderate conscious or moderate sedation. So moderate sedation has its own code. It is not generally coded or seen under the anesthesia section. So the guidelines states that if the same physician performs the procedure and the sedation, you use the code 99151, 99152, and 99153. And if a second physician provides a sedation, you use 99155, 99156, and 99157. So these are the moderate sedation guidelines. And as I said, we already have done a video on the moderate sedation. Please go and watch them if you need. Next, let's talk about modifier 47 use. Okay, here we go. So the use of modifier 47 is done when the same physician performing the surgery also performs a regional or general anesthesia. And these modifier 47 is appended to the surgical code and not to the anesthesia code. All right, so that's one of the guideline you should keep in mind. Next is about anesthesia time reporting, and this is most important part of the anesthesia section. And you must clearly know what is an anesthesia time or what qualifies as an anesthesia time. So anesthesia time begins when the anesthesiologist start preparing the patient for induction. And this can be in an operative room, this can be in a procedure room, or even in an induction area. And the anesthesia time ends when the anesthesiologist is no longer personally attending and the patient is safe for the post-operative supervision. Okay, so anesthesia time, I will repeat, anesthesia time begins when the anesthesiologist start preparing the patient and ends when the anesthesiologist is no longer personally required. Okay, yes. So is that clear, coders? Let me know in the chat. And let's move on to the next one. Next is about reporting the supply and material. So the supplies such as sterile trays, the drugs, disposable, may be only billed separately when they are above and beyond what is normally included, which simply means that routine supplies are not coded separately and they are bundled. Okay, great. And next, let's look at separate or multiple procedure. Okay, so this is also a good guideline to keep in mind. If more than one surgical procedure is done and that is done in the same anesthesia session, you have to follow two rules. Number one, report only one anesthesia CPT code. And number two, choose the most complex procedure. Then report the combined anesthesia time or the total anesthesia time. So you won't be using two separate anesthesia code. You will only use one anesthesia CPT code, and that is based on which is the most complex one. Then you will combine the total anesthesia time. Okay. And next is about the unlisted services or procedures. So if no codes exist in the CPT manual for the anesthesia service which you're looking for, then you have to use the unlisted anesthesia code. And remember, submit it with a special report explaining the service. All right. And that is all about the anesthesia guidelines. And next, let's move on to the modifiers. Okay, I hope everything is good so far, and let's move on. Here we go. Anesthesia modifiers, and now we are going to talk about the physical status modifiers, and these represent, or these are very important in anesthesia coding because they tell us about patient's overall health and not the procedure itself. So physical status modifier always begin with the letter P and are followed by a single number from, and these modifier ranges from P1 to P6. Okay, so remember they always start with a letter P followed by a single number, and these modifiers can only be appended to the anesthesia CPT codes. So let's go through each one clearly so you never mix them up. Hello, I can see a lot of people are joining as well. Great, hi. Okay, these are the anesthesia physical status modifiers. Now P1 represent a normal healthy patient and no systemic disease, no complication. It's a straightforward case. And P2 means the patient has a mild systemic disease, sometimes like a controlled hypertension or a controlled diabetes, nothing life threatening, but not totally healthier either. Then comes the P3. The P3 indicates the patient with a severe systemic disease. The condition limits the activity and increases the risk. The patient is not in immediate danger, but definitely not stable enough to be considered mild. Next is P4. P4 represents a patient with severe systemic disease that is constant threat to life. In other words, their condition is unstable and life-threatening even without a surgery. P4 is followed by P5. P5 is used for morbident patients, and these are the patients who are not expected to survive unless the operation is performed. So here surgery is necessary to prevent immediate death. And last is P6. P6 is used for a declared brain dead patient whose organs are being removed for donor purpose. So this is used only in organ procurement surgeries. All right. And that is about our physical status modifiers. Now let's move on and let's turn our attention to the qualifying circumstance. So these are special add-on codes that we use when anesthesia is made more complex due to unusual or high-risk condition. So qualifying circumstances describe the situation that increases the difficulty, risk, and intensity of the anesthesia care. And these codes also are not reported. These codes are also not reported alone. They are reported with the primary codes. All right. Yes, these are add-on codes, and they're reported with the main anesthesia CPT code. So let's again look at each one of them so you understand exactly when to apply them. First one is 99100. So we use 99100 for the patients of extreme age. that is younger than 1 year or older than 70. And this adds a risk because the infants are and the elderly patients need close monitoring, right? And they respond differently to the anesthesia. So yes, so they that is a qualifying circumstance. Next is 99116. We use 99116 when the anesthesia is complicated by the use of total body hypothermia. And this technique is used in some cardiac or neurosurgery to protect the organs. And again, this also increases the complexity. Third is 99135. 99135 is for procedure where controlled hypotension is used. That means the anesthesia provider intentionally lowers the patient's blood pressure during the surgery, and this also requires extra skill and monitoring. And lastly, 99140. This is added when the anesthesia is provided during an emergency. And coders, here, the emergency, you have to carefully understand what is the definition of emergency in CPT. So CPT defines an emergency as a situation where any delay in treatment would lead to significant increase in threat to life or loss of a body part. Okay, so emergencies is also a factor that increases the risk. All right, are we good so far, coders? Let me know in the chat. Are we good? Shall I move on to the next slide? All right, great. And next, let's go over the HIPICS anesthesia modifiers. And these modifiers tell us who actually provided the anesthesia service and how the service was supervised. So each modifier changes the reimbursement, yes, reimbursement and reporting responsibility. So it is important to understand them clearly. So we have AA modifier, which is used when the anesthesiologist personally performs the entire anesthesia service. All right. Next comes the AD modifier. AD modifier is used when the physician is medically supervising more than 4 concurrent anesthesia procedures. This is followed by we have QK modifier. QK is used when the anesthesiologist is medically directing 2, 3, or even 4 cRNA. Next, there is a QX modifier. So QX tells us that cRNA is performing the anesthesia service, but is medically directed by an anesthesiologist. Next, we have QY modifier. Use QY when the anesthesiologist is medically directing 1 cRNA. And then there is a QZ modifier. QZ is used when cRNA performs anesthesia service independently without medical direction from a physician. And this is common in states where cRNA can practice independently. Finally, we have QS modifier. QS is used when the service is monitored anesthesia care, that is MAC. So this modifier tells the payer that the type of anesthesia is MAC and not general or regional anesthesia. Then comes the G8 modifier. Use G8 modifier when MAC is provided for deep, complex, complicated, or markedly invasive procedure. And lastly, we have G9 modifier. Also, G9 is used for patient receiving MAC who have a documented history of severe cardiopulmonary disease. So these are high risk patients and require increased vigilance. All right. So we also have to discuss about another modifier, that is a 23 modifier. And this is appended when a procedure that normally does not require uh, an anesthesia or only local anesthesia must be performed. So under general anesthesia, and these services or these procedures are performed under general anesthesia due to unusual circumstance. So let's take the example when a patient is having extreme anxiety or severe phobia and is coming for a procedure that usually does not require any general anesthesia, or just a local anesthesia some is maybe required. So in such cases we can use 23 modifier, that is for unusual anesthesia. All right. Okay. So let's move on. And I think that's all about the anesthesia guidelines. And let's do some exercises. Are you ready? Are you ready, coders, to test these guidelines? Okay, I can see yes in the comments. Okay, let's do it. Here comes the first scenario, and I'm pretty sure you don't need 2.5 2 minutes to solve this one. So I will just start the timer and I will start reading the scenario. Of the following answers, which best describe the anesthesia time for the procedure? Option A, 1 hour and 55 minutes. Option B, 1 hour and 35 minutes. Option C, 2 hours and 15 minutes. Option D, 2 hours and 40 minutes. Dr. Patel performs a major orthopedic procedure on a patient. The anesthesiologist begins preparing the patient for induction of anesthesia in operating room at 8:10 a.m. And the surgical procedure starts at 8:30 a.m. and ends at 10:05 a.m. The anesthesiologist remains in personal attendance until the patient is safely transferred to post-operative recovery at 10:25 a.m. Of the following answers, which best describe the anesthesia time for the procedure? And coders, place your answers in the chat. Don't worry. Even if you get it wrong, no worry. We are here to learn together. All right? Give your best answers. Okay, I can see a lot of people are here watching live session. So I expect everyone to participate. Go ahead, coders. All right. I can see a lot of great answers in the chat. Let's go ahead and let's solve this one together. Awesome, awesome job. Okay, so let's begin. Let's once again see the definition of anesthesia time, or how to calculate the anesthesia time. Okay, so anesthesia time begins when the anesthesiologist begins to prepare the patient for induction of anesthesia and ends when the anesthesiologist is no longer required in personal attendance. Okay, so that is how you calculate the anesthesia time. And in this scenario, here we go. We have anesthesiologists who began to prepare the patient at 8:10 a.m. and patient was transferred to post-operative recovery at 10:25 a.m. So that is going to be our anesthesia end time. So anesthesia start time is going to be 8:10 a.m. and anesthesia end time is going to be 10:25 a.m., right? So what is the time difference between these two? So we have 2 hour and 15 minutes of anesthesia time. That would be 135 minutes, right? So 135 minutes would be 2 hour and 15 minutes. Am I right? Are we all on the same page? That makes option A incorrect, option B incorrect, option D incorrect, and option C is the correct answer. I can see most of you have went with option C, and those who have went with a different option, please let me know. Did the explanation help? Let me know the chat. Our team is in the chat. Hi, Miss Jolly. Hi, Miss Rosa. Everyone is in the chat. I can see everyone. Okay, they are here, and they are here to help you. So please let us know if you need any further clarification. Okay, now let's move on to the next one. Let's up the difficulty level, and here we go. Here we have the next scenario. Okay, of the following answers, which best describe the correct anesthesia CPT code and total anesthesia time units for this procedure? Option A, 01400, 4 units of time. Option B, 01382, 4 unit of time. Option C, 01400, 3 units of time. And option D, 01382, 3 units of time. Dr. Lee performs a diagnostic arthroscopy of the patient's left knee to evaluate the suspected internal derangement. No surgical repair is performed. The anesthesiologist begins preparing the patient for induction of anesthesia in the operating room at 9 a.m. The arthroscopic procedure began at 9:15 a.m. and ended at 9:45 a.m. The anesthesiologist remained in personal attendance until the patient is safely transferred to the postoperative recovery area at 10 a.m. And of the following answers, which best describe the anesthesia procedure performed? Okay, coders, and your time begins now. You all did a great job in the last scenario. Please continue, and your time begins now. Yes, you all are on fire. I thought this might be a little bit difficult as I didn't told you how to calculate the anesthesia units. Okay, let's go ahead and I'm going to tell you how you calculate the anesthesia units. Okay, so one anesthesia unit is equal to 15 minutes of anesthesia. All right, one unit equals 15 anesthesia minutes. So if you had 15 minutes of anesthesia given, that means you have one unit, okay, one anesthesia unit. If you had 30 minutes, that would be two anesthesia units. So all you have to do is to divide the total anesthesia time by 15 to get the anesthesia units. So despite that, you all rocked it. Awesome job. Okay, so let's see. So in our scenario, the anesthesia start time is 9 a.m. and I think the end time is 10 a.m., right? Okay, so what is anesthesia time? 9 a.m. to 10 a.m. The anesthesia time is 60 minutes. Yes, that is 1 hour. So we have 1 hour of anesthesia time. That is 60 minutes. Now, in order to calculate the anesthesia units, what do? You will divide that 60 minutes with 15 because we know that 1 unit is equals 15 minutes. So you divide the 60 by 15, you will get anesthesia time units as 4. So we have 4 anesthesia time units in our scenario, and that helps me, if I know that, that helps me to eliminate option D and option C. So you are left with option A and B because option C and D both are coding for 3 units of anesthesia or 3 anesthesia unit, right? So option C and D is wrong and we are left with option A and B. Now, both are having 4 units of anesthesia. Now, let's see the difference. The difference between option A and B is in the CPT code. So option option A is coding for anesthesia for open or surgical procedures on knee joint, not otherwise specified. And option B is coding for 013A2, that is for anesthesia for diagnostic arthroscopic procedures of knee joint. Now we have to ask the question, was this a diagnostic procedure or a surgical procedure? Yes. Okay, we can see someone has changed the answers. Okay, that's an hour moment. So yes, this is a diagnostic procedure, right? So this is not a surgical procedure. It's mentioned clearly. Dr. Lee performs a diagnostic arthroscopy uh, of the left knee, and no surgical repair was performed. So this is a diagnostic procedure which help us eliminate the option A. Yes, option A is wrong, and the correct answer is going to be option B, 01382 and 4 units of anesthesia. Are we good, coders? Now, do you know how to calculate the anesthesia unit? Let me know in the chat. Okay, so we learned something here. In this scenario, we learned how to calculate the anesthesia units. Great. Okay, let me know in the chat, and our team is here to assist you. Okay, so let's move on to the next one. Next scenario, scenario number 3 of the following answers, which best describe the correct CPT code for this service. Option A 00320 99100. Option B 00320. Option C 00326. Option D 00326 99100. All right. A general anesthesia is administered to a 10-month-old infant undergoing laryngoscopy with surgical intervention of the larynx. The anesthesiologist prepares the patient for induction and provides anesthesia throughout the procedure. Of the following answers, which best describe the correct anesthesia CPT code. All right, coders, your time begins now. All right, coders. That is time. You're absolutely correct, Miss Rosa. Miss Rosa said that if you get it incorrect, that's okay. That's aha moments, and aha moments are priceless. So we're going to have some aha moments here. Okay, so let me start reviewing the scenario. Okay, so here we go. So what do we have here? We have CPT code 00320 in option B and option A. Both are coding for anesthesia for all the procedures on esophagus, thyroid, larynx, trachea, and lymphatic system of neck, not otherwise specified, age 1 year or older. So this is coding for patient whose age is 1 year or older. Now it's time for us to look at the age of our patient, the age of the patient mentioned in our scenario, and that is 10-month old infant, right? Yes. So general anesthesia is administered to a 10-month-old infant in our scenario. So we have a age mismatch with the CPT code. So option 00320 is an incorrect answer, while 00326 is coding for anesthesia for all procedure on larynx and trachea in children younger than 1 year of age. And that is much more suited, right? That is a correct answer, actually. So that's a correct CPT code. So option B and option D is incorrect. Okay, option B has to go. Sorry, option B has to go, option A has to go. These two are incorrect. Now we are left with option C and D. Both are coding for the same CPT, and only thing which is additional in option D is that it has an add-on code 99100. That is for anesthesia for patients of extreme age younger than 1 years and older than 70 years. Okay, so this is qualifying circumstance. So my question is that do we have to code this along with the anesthesia CPT in our scenario? And yes, I can see one of our coder has already mentioned it in the chat. Read your parenthetical guideline too. I know that I haven't placed the parenthetical guideline here. So yes, one of our coder has mentioned read the parenthetical guideline. Okay, coders, now do you want to change the answers? Let me know. If you want to change the answers, go ahead. Change it now. Yes, you cannot. Okay, so someone has mentioned the screen is small, very difficult to read the scenarios. Okay, please, I think you are in the mobile version. You are using the mobile view. So if you are in a desktop currently, there is another link in the YouTube channel, so you can change to that particular video that is specifically for the web use, for the desktop users. All right, so you can try that. Okay, so I can see some people. Okay, answers are still coming. Yes. Thank you, Miss Rosa, for placing that link in the chat. So if you are in a desktop, please go ahead and use this particular link. Okay, so the parenthetical guideline states that you should not use 99100 with 00326. And there is also another reason, logically also, if you think, do you need an additional or an add-on code to say that the patient is 1 year or younger than 1 year when it's already mentioned in your CPT code language? No, right? Yes, if you read the code language for 00326, it's already mentioned over there. This is for anesthesia for all the procedures on larynx and trachea in children whose age is younger than 1 year of age. So do you need an additional code to once again reemphasize that? No, you don't need that. The code language itself explains that this is for a procedure on patient younger than 1 year. And moreover, the parenthetical guideline also states that you should not code this together with 99100. And that makes option D incorrect. And the correct answer is going to be option C. Yes, aha moment is in the chat. True. So you learned something new that is priceless. So I'm going to put this across. Great job, everyone. So that was a good scenario, right? Yeah, that was a aha moment. So let's move on to the next one. So good job, everyone. Good job. Let's move on to exercise number 4. Here we go. Of the following answers, which best describe the correct CPT, Anesthesia CPT code for the service? Option A 01230 with the P3 modifier and 99100. Option B 27506 with the P3 modifier 99100. Option C 01230 P4 and 99100 with the 51 modifier. Option C 01210 with the P4 modifier. Anesthesiologist provides general anesthesia for open reduction and internal fixation of the femoral shaft fracture in 76-year-old patient's medical history is significant for severe COPD, chronic obstructive pulmonary disease, and congestive heart failure, placing the patient at high anesthetic risk. Of the following answers, which best describe the encounter? CPT anesthesia CPT codes for this service. Encoders, your time has already begun. Place your answers in the chat. Okay, that is time, and I can see answers are still coming through. Sorry. So let's move on, and let's go ahead with this scenario. Please continue to place your answers in the chat. In meanwhile, we will work on this scenario. Okay, so let's look into the code options which we are having. Option A is coding for zero. Sorry, option D is coding for 0121. 0, that is for anesthesia for open procedures involving hip joint, not otherwise specified. So we are not looking at a procedure performed at the hip joint. We are looking at a procedure done, or we are looking at anesthesia given for a femoral shaft fracture treatment, right? Yes. So this is a incorrect procedure. Option D is wrong. Now let's see what's next. Option B is coding for 27506. That is for open treatment of femoral shaft fracture, right? So you have to be a little bit forensic over here, coder. So Here at AMCI, we always say read the last portion of the question first. So you have seen we also practice that while doing the scenarios. We always read the last portion of the question because that gives us an idea what we are looking at. So the question was, of the following answers, which best describe correct anesthesia CPT codes? So 27506. Do you think this is an anesthesia code? No, right? This is a surgery code. This is for a fracture treatment. So we are not going to use this code for this scenario. The question was, what's the correct anesthesia CPT code? So just being a little bit forensic would have helped us to eliminate option B. We're left with option C and option D. Now, both are coding for 01230. That is for anesthesia for open procedures involving upper to third of the femur, not otherwise specified, and 99100. That is for anesthesia for the procedures performed on or for extreme age younger than 1 and older than 70 years of age. So that is a good one because the patient's age was 76 years old in our scenario. So that's a good one. And only difference between option A and I think option C is that option A is coding for a P3 modifier, physical status modifier, and option C is for P4, right? So P3 is for patient with severe systemic disease, while P4 is for a severe patient with severe systemic disease. That's a constant threat to life. So there was no mention of a constant threat to life over here. Yes, patient was at a high anesthesia risk. Patient was having severe systemic disease, but it's not clearly mentioned whether it's a constant threat to life, right? So that makes option C incorrect, and option A is going to be the correct answer. Okay, so we had most of them going with option A. Few have went with option C as well. So I hope the explanation helped. And let me quickly move on to the next one. We got few. This is the last scenario. Then we have few some fun exercise. We will do that as well quickly. So here we go. Fifth question code is, of the following answers which best describe the anesthesia service. Option A 01810 QZQS. Option B 01810 QZG8, option C 0180 QX and option D 01810 QY and QS. Okay, Dr. Rodriguez prepares to perform carpal tunnel release on a patient's right hand due to have not responded conservative to the conservative treatment. Mr. Smith, certified registered nurse anesthetist, administered monitor anesthesia care. Dr. Rodriguez successfully completes the procedure and the patient is transferred to the recovery room for post-operative monitoring. Of the following answers, which best describe the anesthesia care? Okay, Codis, time begins now. You got this. All right, that is time, and I know that you are still working. No worries, no worries. Please continue. But since we are almost time, so I will walk you through this scenario. You all have been doing great job. I can see answers in the chat. Wonderful job. Even if you get it wrong, don't worry. As I said, you all are doing a fantastic job. So this particular scenario was all mostly about the modifiers, right? And here in diagnosis inventory, we have patient with carpal tunnel syndrome of the right hand, and procedure inventory, a carpal tunnel release was performed. So we have only one CPT code, anesthesia CPT code, that is 01810, which is for anesthesia for all procedures on nerves, muscles, tendon, fascia, and bursa of the forearm, wrist, and hand. So that is going to be a CPT code. Now we have to choose the correct answer. For that, we have to be spot on with these modifiers. Okay, so in our scenario, let's have a forensic look into our scenario. Mr. Smith, a certified registered nurse anesthetist, administered the monitored anesthesia care, right? So it's a CRNA who administered the monitored anesthesia care, or MAC. And was the CRNA medically directed? No. CRNA himself administered the MAC, right? So QY modifier is for anesthesiologist that medically directed a CRNA in a single case. So this does not apply here. We are looking at a CRNA who medically administered the MAC. So it's wrong. Option D has to go. Now option C is coding for a medically directed CRNA. Now this is also incorrect. Yes, this also have to go. Fantastic answers. Great job, coders. I'm just looking at the chat at the same time. So beautiful job. And now we are left with option A and option B. Both are coding for QZ modifier, that is for a CRNA who is performing anesthesia service without medical direction by a physician. So that's exactly what happened here. So that is a good one. Now option A and option B only differs in terms of the modifier Q, S, and G8. So G8 is for monitored anesthesia care for deep, complex, complicated, or markedly invasive surgical procedures. So we had a carpal tunnel syndrome and carpal tunnel release. So that's not a deep, complex, or complicated procedure. So that makes option B incorrect, and the correct answer is option A, which is coding for QS modifier, which is for monitored anesthesia care service. So the correct answer, as most of you have said, is option A, 01810 QZ and QS modifier. Okay, so yes, sometimes these modifiers can be confusing. So that's why we say, churn your manual. Yes, churn your manual. So that will be also helpful, and you don't have to buy hard these modifiers. You know that it's in your HIPX book, so don't worry. Anesthesia is a pretty easy topic. Only thing which you have to do is you have to read them forensically. You can score the points easily. Read them forensically and you all will be in a great position. Okay, so that concludes our scenarios. Now we will have a quick rapid quiz section. It's a poll time, it's a hand poll. You can have the answers in the chat. So it's a rapid fire session. Coders, go ahead and place your answers in the chat. So we'll have it quickly. And the question is, what modifier best describe this situation? Option A, 47, option B, 22, option C, 23, option D, P6. A patient was placed under general anesthesia to have simple incision and removal of foreign body from subcutaneous tissue. The procedure usually requires a local anesthesia due to unusual circumstances which require general anesthesia. What modifier would best describe the situation? Okay, you all are so fast that you started placing the answers way before I completed reading the scenario. Hmm. Okay, okay, good. Come on, Godas. This is a rapid fire scenario. So all these guidelines we reviewed just before. And the correct answer is yes. Unusual circumstances. You use 23 modifier. That is for unusual. Sorry, that's for unusual anesthesia. All right. Good, good. Great. I see your answers now. Fantastic job. Let's go to the second one. Okay. Your options are option A 99100, option B 99116, option C 99135, option D 99140. What add-on codes should you report in addition to the code for primary anesthesia procedure to describe the anesthesia complicated by utilization of total body hypothermia? Let's go, coders. Please your answers in the chat. Anesthesia complicated by utilization of total body hypothermia. There you go. There you go. Outstanding. Yes. Outstanding. Yes. The correct answer is option B 99116. That is for anesthesia complicated by utilization of total body hypothermia. Wonderful job. Wonderful job. Okay, let's move on to the next one. We have a few more. There you go. What physical status modifier should the coders append to describe the patient with severe systemic disease? Is it option A P1, option B P2, option C P3, option okay, you are not even allowing me to complete reading. Option D P4, severe systemic disease. You want to change the answers? We just did a scenario on this particular modifier. Severe systemic disease. The last one, I believe. Okay, right? Last one. Not last one. I think one before that. Yes, it is P3 modifier. The patient with severe systemic disease and the only the I remember from the last scenario because the last two options was one needed severe, one was with the severe systemic disease, and the other was with severe systemic disease with just constant threat to life, right? So yes, so this is how the practice helps us in remembering as well. So just by doing that scenario, it suddenly came to my mind. Okay, great. So keep on practicing, coders. Let's move on to the next one. I think we got only one more after this. Yeah. Okay. According to the anesthesia guidelines, what forms of monitoring are not included or bundled with anesthesia service? Option A, intra-arterial. Option B, central venous. Option C, SWAN, GANS. And option D, all of the above. What say you, coders? Okay. All right. Good. Great. Any more answers? Shall I reveal the correct answer? Okay, I will wait for 2 more seconds. 5 more seconds. Come on, Godas, you can do it. Okay. Yes, the correct answer is going to be option D, all of the above. And here it says, okay, unusual forms of monitoring such as intra-arterial, the central venous, and SWAN GANs. Sorry, SWAN GANs are not included, and you can report them separately. Okay, let's move on to the next one. All right, so which physical status modifier should be applied for anesthesia coding scenario? A 76-year-old man with an end-stage heart failure is rushed to the operating room for emergency cardiac surgery due to rupture of his left ventricle. The patient is in cardiogenic shock, unresponsive to maximum medical therapy, and his chances of survival is extremely low, even with the surgery. Which physical status modifier should be applied for this anesthesia coding scenario? Okay, All right. Okay, thank you. Thank you for letting me know that the lecture is helping you. Thank you. The correct answer is going to be yes. It is going to be, is it option 5? Sorry, or option D or option 4. Okay. So let's see the answer. Let's see the modifier, right? I think it's option C. It's not option D. Okay, yes, the correct answer is it is option D, by the way. Yeah, it is for a morbid and patient who is not expected to survive without the operation. And yes, it's option D. That is the correct answer. Okay, now let's move on to the, I think this is the last hand poll scenario. Give your best shot, Chorus. When reporting for an anesthesia service using CPT code 00100 through 01999, which service is not considered inherently included? Option A, administration of the blood. Option B, electrocardiogram. Option C, capnography. Option D, central venous catheter. Which of these services is not considered to be included? Okay, all right. Absolutely correct. AMCI amazing coders are in the chat. The correct answer is option D, central venous catheter. Yes, awesome job. All right, all right. So, how are you all doing, coders? Let me know in the chat. Did you find this session helpful? If you enjoyed the video, smash that like button and subscribe to AMCI channel. Share it with someone who needs to see this. If it helps them, yeah, the purpose is done. Okay, so I am placing the survey link in the chat. Thank you for letting me know that it helped. Please kindly fill out that survey form, and if any of your answers or questions were unanswered, you can place them in the survey link as well. So we will be getting back to you. So don't forget to like that button, hit that like button, subscribe and share, and also fill out the survey form. Thank you, everyone. Thank you for joining. And we will be back next week with another topic, breaking down another CPT guidelines and doing some scenarios as well. So, till then, stay safe, keep coding, and see you all next week. All right. So, please fill out the survey form and take care. 4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at